pandemic has been hard on all of us in different ways. But some experts say it's children who've suffered most. An important phase in their lives when they learn how to interact socially has been interrupted. In parts of the world, kids have spent months doing lessons in front of a computer. In developing countries, many children have missed months of school altogether. How will a generation of children who grew up in the pandemic cope with the future? Will it teach them resilience or weaken their development? Welcome to your COVID-19 special. I'm Chelsea Delaney in Berlin. In many countries, children are now able to receive COVID-19 vaccinations. Health experts say that's a crucial step to protecting children and their families, as well as keeping schools open. Here in Germany, children ages 5 to 11 have been eligible for jabs for just over a week. We had a look at how things are going here in Berlin.
Julia was lucky. The 9-year-old girl was one of the first children under 12 to get a COVID-19 jab here at a vaccination center in Berlin. Julia knows why she's come. Well, because it chases away corona, and I think it's just good. Julia was a premature baby, born 3 months early, and very, very often we were in the hospital with pneumonia. She had to be on a ventilator, and we don't want to experience that again, no matter which virus. Just like Julia, all children from the age of 5 are now able to get vaccinated in Germany. In vaccination lines set up especially for children, they receive a lower dose than the regular one. Many parents have been waiting for this step, given the high COVID-19 cases among 5 to 11-year-olds across Germany. We have the highest rate in this age group. In Berlin, it's between 700 and 800. In other German states, it's much higher, and there is a great risk of infection. And the course of the disease among children is not always mild. Special locations have been found to make getting the jab more attractive for kids. Here in Berlin's Nature Museum, children get a free ticket to see the dinosaurs after being vaccinated. By including younger kids, politicians hope to finally get out of the pandemic. The more vaccinated people we have in Germany, the better we will be able to fight the COVID-19 pandemic. That applies to all generations, and vaccinated children also offer protection for their family at home. Julia and her parents chose the jab because it makes them feel safer. The government hopes that many other families will now follow suit.
Now, for more on this, I'm joined by Jörg Dutsch from the German Society of Pediatrics and Adolescent Medicine. So, Jörg, after being in this pandemic for almost 2 years, how are our kids coping?
Well, actually, at the very moment, they're doing a little better because school has not been on and off as it used to be at the beginning of this year. But there was a certain degree of persistence of uninterrupted possibility to meet other children and to have teaching experience. So we actually know from the inquiries that they're doing better than they did at the beginning of the year.
So there is some stability now, but how has the pandemic hit different age groups differently throughout these past 2 years?
Well, there are certain things that have to be put into consideration. Well, first of all, adolescents, they are very keen on getting in touch with other adolescents in their age group, whereas younger kids, they have more contact to their family environments, certainly, and they can more easily be stabilized by the families, by the parents. So it's actually, in particular, the adolescents that we are concerned about. And another big concern is those families that haven't got all the means of supporting their children, that for instance, don't have access to Wi-Fi. They don't have access to laptops and everything you need for for getting in touch apart from meeting each other. So it's not only a matter of age, but it's also a matter of access to technique.
You mentioned it there, but there has obviously been a lot of concern about the impact this is having on children's mental health. What should parents or adults be looking out for in their kids?
Well, there are certain things that we have learned so far throughout the pandemic. On the one hand, they should keep an eye on the eating behavior of their children. Are they getting more obese? Are they eating too much? And are they moving too little? Or is it the opposite? Then on the other side, they have to take care of their children not getting depressed, not being sad throughout the day, or not losing their degree of activity. And finally, they certainly have to take care that children really still are in touch with their environment, that they ask questions, that they stimulate their parents, that they even criticize their parents. As long as they do this is fine. When they stop talking and when they stop getting in touch with their environment, one has to worry about that.
So we're at a point now where children are eligible for vaccines in some countries. Do you see that as a game changer?
It's possibly not a game changer, but it's extremely good news, especially for the girl that we saw in the little movie that you just had, Julia, who has risk factors for a more severe cause of COVID-19 infection. And for those children, it's extremely good news, as well as for children that have relatives in their families that are predisposed for a more severe cause of the disease. Then again, in other children, parents may be quite convinced that the vaccination is the right thing to do, and we absolutely stimulate those parents to have their children vaccinated. But at the same time, we don't argue with parents that are not sure about the actual state of the vaccination, whether they should vaccinate or not, or have their children vaccinated or not, because they are not yet sure about all the side effects, and we don't want to stigmatize these parents either. So it's up to the parents. The parents should try to keep as well informed as possible by what they can read, but also talk to their pediatricians, to their family doctors, to get more information and to draw a decision. And at the end of the day, it's most important not to stigmatize the parents that don't vaccinate, and neither parents that decide for the vaccination.
That is Jörg Dutsch from the German Society of Pediatrics and Adolescent Medicine. Thank you so much.
Thank you very much for the interview.
Now it's time for you to ask and for us to answer. Here's a viewer question for our science correspondent, Derek Williams.
Can you tell us more about the effects of long COVID in kids?
One of the few upsides, if you will, of SARS-CoV-2 is that at least during the active infection, children are largely spared serious outcomes like hospitalization and death. But that doesn't mean that some of them won't eventually pay a price. Estimates for what percentage of children suffer symptoms associated with long COVID in the weeks and the months following an infection, they're kind of all over the place. But most researchers in the field seem to agree now that it's significant, although recent data indicates, thankfully, it might not be as common as we once thought. Some early research postulated that post-COVID symptoms might affect up to half of all the kids who got it. That estimate has dropped considerably, with a larger recent study roughly finding more like 1 in 7 kids are still reporting symptoms over 3 months after a COVID infection. Just like in adults, those long COVID symptoms have also been very wide-ranging in kids. The most serious reported effect is called multi-system inflammatory syndrome in children, or MIS-C, which can lead to organ failure. It's fortunately pretty rare. There have only been around 5,500 cases of it reported in the US so far, for instance. More common effects are sometimes, but not always, similar to those reported by adults, like fatigue or labored breathing or headaches or changes to the sense of smell and taste. Neurological symptoms like brain fog or difficulties concentrating are also widely reported. Some studies show that vaccines appear to help cut the risk in an adult of developing long COVID if they experience a breakthrough infection, maybe by as much as half. But there isn't enough data yet on whether they also reduce the risk of it in younger kids. We just haven't been vaccinating them long enough to know.
And finally, Pakistan's lockdown may have been tough on humans, but it's been a great opportunity for sea turtles to breed. They used the lockdown to return to their birthplaces in huge numbers, reclaiming the once polluted but now serene Karachi beaches to lay their eggs. Their numbers jumped from around 8,000 in 2019 to 15,000 last year. Thanks for watching.